Welcome back to my Spoonie Sisters. Today, I've got the beautiful co-host, Indy Byers, the one, the only. Also, today on the podcast, we're welcoming an incredible advocate who turned her pain into purpose. This is Amy. After years of medical gaslighting and struggling to find her voice, Amy stepped into the world of advocacy, following her pulmonary arterial hypertension. This was a diagnosis in March of 2023. Since then, she's faced additional diagnoses, including an atrial septal defect, a rare genetic mutation, and even a battle with breast cancer, all while raising her son as a full-time single mom and part-time hairstylist. Through it all, Amy has been determined not only to spread awareness, but about chronic illness, also to help others find their voice in a system that too often silences them. Today, she joins us to share her journey, the power of community, and why she refuses to let her diagnoses define her future. Let's welcome Amy to the show. Hello, ladies.
Hello.
Hello.
It is so nice to have you both here today.
I'm excited to talk to Amy.
Me too.
Thank you for having
Amy,
me.
welcome to the pod. We sometimes go rogue, but it's a fun kind of rogue. We've given the kind of stuffy background. Can you tell our listeners more about you from you?
Sure.
Tell us about
of course.
yourself.
So me personally, diagnosis aside, full-time mother. I'm recently going through a divorce, so that has been challenging. But in my spare time, I enjoy baking, I enjoy reading, and spending time with my son. I was diagnosed with pulmonary arterial hypertension back in March of 2023. After battling symptoms, the shortness of breath, heart palpitations, the fatigue, chest pains, and the edema, so the leg swelling. I suffered with that for about 2 years before I finally got my diagnosis. And it was definitely life altering. I was diagnosed on the 22nd and admitted right into ICU on the 3rd. I didn't really have time to absorb the information when it happened to me. I was diagnosed. My PH specialist explained to me what pulmonary arterial hypertension is, which for those who don't know, it's the stiffening or narrowing of the arteries in your lungs, which causes your heart or the right side of your heart to kind of overwork. And if it goes untreated, it can cause congestive heart failure. Thankfully, I do not have congestive heart failure. I have right ventricular failure. So the right ventricle in my heart is extremely enlarged and overworked. He explained all of that to me and then proceeded to tell me that I needed to start IV medication as soon as possible, which is why he admitted me into ICU the next day. I was in the hospital for, I think, 14 days. I was there for 4 extra days because they were battling my health insurance, trying to get my medication covered so that I could be discharged home. When I was sent home, I think that's when it finally hit me how much my life had changed. Being attached to a medical pump. At the time, I had a central line in my chest and this big brick pump that I had to carry around with me everywhere. I had to mix my own medications. And at that time, it was like I could feel sorry for myself, or I can take everything that I just went through and turn it into something positive. So that's when I decided to start my Instagram and my TikTok to kind of spread awareness for what I had just gone through.
What was the turning point that made you realize you needed to speak up for yourself and for others?
It was probably 3 months into my diagnosis. I was suffering from severe contact dermatitis on my skin from all the adhesives. Because with the central line, you have to keep it covered with a dressing and you have to clean it every week. And I was getting pretty much blisters, almost like a chemical burn from the adhesives on my skin. I was going back and forth with the doctor, extremely frustrated. It got to the point where nothing would stick to my skin because it was so blistered. I was in so much pain and it was just uncomfortable. Finally, my doctor agreed to pull the central line and put me on sub-Q medication. It's the equivalent to the IV medication I was on, but it's subcutaneous and it was a much smaller pump. And it's very similar to an insulin pump. It would have a site that I would have to put on and then hook up the machine. Again, the little pump, it was 24/7, but I could move my site. So I would change my site every like 4 weeks or so. So it kind of limited the reactions to my skin. It was one of the nurses in the hospital when they were switching me said to me, "You're his only patient that's on this sub-Q." And they were all curious about it. It made me stop to think, there are so many other medications out there. Why wasn't this brought up to me? I was suffering with depression because it was so difficult to shower with a central line and this big pump that I couldn't detach from. I was getting depressed from just not being able to shower, or how concerned I was, like getting dressed. Okay, I want to make sure I can hide my central line, where I'm going to put this pump. It was a lot, and it was a complete change to my everyday living. At that point, I realized it wasn't just a conversation that I had with my doctor about what I needed in my life. I really stopped and was like, I know there's other medications out there. Why didn't we have this conversation? And that's when, I decided that I was going to talk to my doctor about the different treatments out there. And, quality of life is extremely important. I think a lot of doctors forget that when it comes to their patients. And that was pretty much the eye-opening moment for me.
I want to pause for a second, talk about your heart, because it's scary, right? Because it's scary, right? I have heart problems. So I wanted to sit and talk to you. How did you process and cope with, this thing is responsible for keeping me alive, and now my job is to focus on it? How did you cope with the pieces of independence as diagnoses came and you had to perhaps maybe navigate care in a way that was not always you focused, but should have been?
I'm going to be honest with you. It took a little while. It didn't really hit me until shortly after I was diagnosed with the actual atrial septal defect, which was in February of 2024. I had gone almost a year without having the atrial septal diagnosis. When I got that diagnosis and the genetic mutation linked to it, that's when I realized that there was no going back. My life had this new normal. When I was diagnosed, the nurse that was set up to do my home training with my medications and everything said to me, "Oh, there's a new drug that's in the works. It's showing amazing results. It's reversing some of the damage to people's hearts, and it's going to be great. And it's one of those drugs, can't wait for it to be approved so then you can be on it." And there was a lot of hope. When I got the diagnosis with the heart defect, I realized this is a genetic mutation. This is me. There's no going back. I think that's the moment where I realized I'm never going to go back full time to work. I'm going to be on this medication for the rest of my life. It's a progressive disease, which I knew in the back of my mind when I was diagnosed. I think at that moment where pretty much that hope was stripped away, that medication was never tested on heart defect patients. Statistically, I don't know what kind of risks would be for a patient like me. It was one of those things where my doctor was like, not quick to put you on it. I think that moment where I realized everything's completely different. That's another clicking point where I was like, okay, I'm going to turn something positive and start really advocating. I try not to think about the mortality rates, especially since pulmonary hypertension and heart defects have come a long way over the years. I know if we were having this conversation 10 years ago, my prognosis would be like 2 to 5 years. But because medical advances and all the medicines that are out there, people are living a lot longer with pulmonary hypertension.
So you are a hairstylist, you mentioned?
Yes, it's a second career. I had always wanted to be a hairdresser. I was raised and told I had to go to college. Hairdressers don't make any money. And so that's what I did. I went to college. I ended up dropping out after a year and found my way into medical billing for 8 years. 19, I came up with the opportunity to go back to school. So I was like, I'm going to do what I've always wanted to do, and I'm going to go to beauty school. And I did. Ended up in the middle of beauty school, maybe 2 months shy of graduation when COVID hit and everything got shut down. And it put a huge delay on my graduation. I mean, I had quit my job. I had mainly supported on my husband at the time and my parents for supplement income because I wasn't working. So I could go to school. When everything got shut down, it was pretty crazy. I eventually was able to go back, and I graduated and finally got my dream job in the salon that I'm working at. And not even a year into it was when I was diagnosed with the PAH. I think that was the other reason why I was so stubborn and didn't want to realize my life's different, because I worked so hard to become the hairstylist that I've always wanted to be.
Yeah. Would you say that navigating that made your mental health, how you advocate stronger, how you advocate for you and how you advocate for others? Because we process so much while going through diagnoses. There's layers to that going through diagnoses journey. Do you think that going through it gave you better tools to navigate conflict, like in the internal conflict of, I might have to give this up, but I can also still do these things? How did it change your perspective?
I'm a very stubborn person. When I was diagnosed, my doctor pretty much said to me, "Oh, you're not going to go to work. You're going to need to apply for disability. That's just the way it is." I looked at him and I said, "Why?" He kind of looked at me like nobody ever questioned him before. And I was like, "Why can't I work? I work at a very higher end salon. I'm not booked back to back. I can relax between clients. Like if a color's processing, I can sit down. I work at an organic hair salon, so there's no harsh chemicals. I don't have to do hair straightening treatments or perms and reduce my chemical exposure. So why can't I go back to work?" He kind of said to me, like, because again, I had the central line. He had said to me, like, "Oh, well, you can accidentally cut your central line." I kind of looked at him. I think you're grasping for straws because it would take a lot for me to accidentally cut a central line that's under my apron, under my clothes. And he kind of looked at.
Is he expecting you to trip and fall and cut yourself open with your scissors?
Like,
I don't know what he was expecting.
What kind of haircut are you giving that you cut your central line?
I have no idea. I think he was just really, really trying to grasp for straws. We're pushing it here. So he was kind of like, "Okay, we'll talk about it. First, you need the first, few months to get situated and then we can revisit it." So I was like, okay, I like that answer a little bit better. After a few months of check-ins on the medication and everything, I said, "Okay, I'm ready to go back to work." And he kind of and I said to him, part of being ill is mental. And if somebody's sick and they're not mentally okay, and in order for me to get better, I need to do things that I love. My job is one of them. If you tell me to go home and collect disability and sit in bed all day, I'm going to be depressed and I'm not going to get any better. And so at that point, he was kind of like, "All right, we'll start it out slow. You can do a few hours behind the chair." I think we started off with 2 days a week. And then I was like, "Okay, I'm feeling really good." So then we added another. So currently I'm 4 days a week behind the chair. So I only work 16 hours, but it puts me in a better mental headspace.
Yeah.
So I think just being stubborn and not letting him pretty much just take my love, everything I love away. And I think that's really important. And I think sometimes doctors forget, like I said, the quality of life and how strong healing mentally is.
Yes. I love that.
Absolutely agree. I think it's so terrible to find out we're diagnosed with things and then to take away everything that we love that leaves us in a hole of despair. And how are we ever going to come out of that if we either can't do the things we enjoy that we were doing before, or we can't find other things that are joyful? Because there's a lot of people out there that, okay, let's say are really super into fitness and then they're diagnosed with something and that's taken away. Okay, so now they're grieving two losses, right? So you've fought really hard to keep doing hair. Are there other things that you've found also bring you joy?
Yeah, my advocacy work. I enjoy posting my videos. The community that I found online from not just fellow pulmonary hypertension patients, but other chronic illness patients out there, it's amazing to get comments from people just saying, "Thank you for posting your videos. It makes me feel less alone." That's why I love doing the advocacy work. There's one message that I received from somebody, and I'll never forget it, and it will stick with me. I had posted a video after I had switched to the subcutaneous pump about how I showered, how I covered my site so that I could detach from my pump, cover it, get into the shower, and take a real shower, which I hadn't been able to do for almost 4 months prior to that. I had posted the video how I covered it up. I had somebody message me saying, "Oh my God, thank you so much for your video. I had been struggling to take a shower and your video has helped me." And it made me realize, that's it. That's all I wanted. Just one person, just to be able to reach out to and connect with one person can make everything that I went through have a purpose.
I think that's the perfect example of why all of us in advocacy do what we do. We're not doing it for ourselves. We're not doing it for the accolades. We are showing up and doing it to try to help someone. And even if it's only one person out there, we want someone out there not to feel alone and to feel heard, understood, feel like they're getting answers, because it's one thing to get answers from a doctor, but it's another to get lived experiences from someone living the same life that gets it.
Yes, absolutely. Nobody knows your body better than you. And sometimes doctors forget that. So again, that just brings back full circle quality of life and how important it is for a patient to have that conversation with a doctor, because that's not their forethought. They're thinking about treatment and how to get you better, not necessarily thinking of how it's going to affect your quality of life.
What made you decide to start sharing your story publicly?
The lack of knowledge around pulmonary arterial hypertension. It takes an average of 2.8 years for a patient from the onset of their symptoms to properly get diagnosed. And as I stated, it's a progressive disease. So the earlier it's caught and treatment started, the better prognosis you have in life. I had never heard of it until I was diagnosed with it. So I wanted to get my story out there so that I can help other people who've been struggling with maybe the same symptoms as me get answers. Hindsight's 2020. I look back and I have a video 2019 where I'm like video recording my son riding his bike, and I'm standing there with the camera, and you can hear me breathing in the background of the video. And I'm not even doing anything but standing there. In December of 2021, I had a moment where I had almost passed out, and I went to the emergency room and I complained of a prolonged cough, the heart palpitations, the chest pain, feeling of dizziness. And they had noted the leg edema and pretty much just told me, we think you have some viral infection, like respiratory infection. Just go home, get plenty of rest, and drink liquids. And I said, okay. Again, didn't question it. And I kind of pushed them away on the back burner and just ignored them. In October of 2022, right before my diagnosis, I started coughing up blood. Okay, it's scary. I've watched enough medical shows to know that that's something serious. I went to the emergency room and I was sitting in the waiting area for a couple hours. I had another episode of coughing up blood while I'm waiting. And they kind of felt like they weren't believing me. What was going on. So they did the blood work. They did a CT scan and an EKG. And the doctor came over to me and said, we ruled out pneumonia and it's not a pulmonary embolism. So we're going to send you home. I looked at him and I said, okay, but where's the blood coming from? Like, I'm coughing up blood. Where's it coming from? He looked at me and goes, I don't know. And was all set to discharge me.
Wait a minute. Here's the thing. Our holes in our bodies are not meant to have blood. Well, there's only one hole that's meant to have blood. But we're not meant to have blood coming out of our ears, our eyes, our mouth. It's just not normal.
No, he sent me home. I called my PCP because it continued for like 3 days after that. I was having these episodes. I called my primary care doctor and they got me an urgent care with a pulmonologist, an urgent visit. He was like, oh, I see some in your lungs in the CT scan. It looks like you might have some like low-grade pneumonia. I'm going to give you an antibiotic. I said, okay. I'm thinking, yes, finally. At least he's addressing the fact that I'm having this symptom and is trying to fix it. I took the antibiotics and I stopped coughing up blood. So I was like, okay, I'm going to go about my day. That was just very weird. And it happened again in February. So February 2024, again, started coughing up blood. I was out with my now ex-husband. We were driving and I told him, I said, you have to pull over. And he pulled over and I started coughing and he called 911 to get an ambulance to come get me because we also weren't familiar with the area where the closest hospital was. I'm thinking, okay, maybe if I get an ambulance, somebody's going to take me seriously. And they brought me to a different emergency room who's like, oh, well, they couldn't find anything back in October. Why do you think we can find something? So I called that same pulmonologist again that said I had pneumonia. And I said, it's happening again. And so he's like, okay, I'm going to put in for an echocardiogram. I said, okay, great. I had that done. He calls me up the next day and says, very briefly, nonchalantly says, well, you have pulmonary hypertension. I'm going to put in a referral for a right heart cath, and I want you to see this specialist afterwards. And he gave me the doctor's name. I said, okay. So again, there was no urgency addressed to me. I had never heard of it. I didn't think like, oh, let me Google it. So they called me to schedule the right heart cath. And I'm thinking like, okay, well, I need to rearrange some of my clients. So can we push it out a week so I can have like, so I can take care of my life, not thinking like my health was more important. When I finally got the right heart cath done, I had the right heart cath scheduled. I spoke to the secretary who said that I told her I had my right heart scheduled on the 21st. I was told to see the specialist after my right heart cath. And she said, yep, not a problem. Let me get your information and I'll call you back. I said, okay. So she calls me back and says, okay, he wants to see you on 22nd. I was like, oh, that soon? I'm thinking, oh, I got lucky. I got like, they must have had a cancellation. She's like, yep. And I said, okay. So I had my right heart cath on the 21st. I saw the specialist on the 22nd. And he looked at me and he goes, I saw all your scans from October and your EKG that they had done back in December of 2021. I knew that you had pulmonary hypertension and how severe it was before I even saw your right heart cath and before I even met you.
Hey, listeners, are you living with a chronic illness and want to make your voice heard? Rare Patient Voice connects patients and caregivers with research opportunities so you can share your experiences and get paid for your time. Your insights help drive real change in healthcare. So sign up today using the link in our show notes and start making an impact.
Yeah.
That's a big deal right there. Did you feel seen in that moment finally?
Yes, that's kind of what rose-colored glasses, because I was finally being heard and getting answers that I didn't stop to question. Like when he said, I'm admitting you to the ICU, we're starting you on this pump, and this is how things are going to go. I never stopped to question what other treatments are there, or even the question of how long do I have to live? Like that thought didn't cross my mind. He just stressed how serious it was. After that appointment, I definitely went to my car and I cried. But it was that sigh of relief. I think a lot of people who struggle to get a diagnosis all have that same realization. It's the sigh of relief of finally get a diagnosis and being heard. Then you have to face the fact that this is life. You have to face the actual diagnosis.
I think something for listeners to understand too is when you receive a diagnosis, doesn't matter what the diagnosis is, there's always tears involved. It's not for attention. It's tears of finally feeling heard and seen. It's tears of grief. It's tears of joy for finally having that answer. I mean, there's so many different reasons why there are tears. It's not always what people think it's about.
You know, that's so true because a majority of the world would like to assume that the tears are for pity, and it's not. We're just processing the layers of emotion as they come, good, bad, ugly, indifferent. But it is not necessarily for any of the negative reasons why people associate sad and tears. Like, are we sad? Yes. Do we have some sad moments? Yes, and rightfully so. But us outwardly expressing that sad or that emotion is no different than the healthier, more able-bodied. I no longer use the phrase healthy, able-bodied, the healthier, more able-bodied person than our situation, because they're carrying something and maybe there's something hasn't manifested, or maybe they are navigating the hard part differently. But it bothers me to no end, all the way to the depths of my core, when I hear people go, they want pity. Nah, I don't, because I'm doing some pretty phenomenal things in this body that's like, I want to sit you down real quick, maybe 2-3 more times, you know?
And let us have our moment to grieve. It's okay. Who wouldn't want to have that moment to just take in the information and maybe cry it out for a few minutes? That's normal. I consider that to be very healthy.
I tell people just don't stay there. Process it, but don't stay there. And it's going to come in waves, and let it come in waves, but don't stay there. Understand that you can still do a lot of phenomenal things on the moments that you have on this earth, without the diagnosis, alongside the diagnosis, making it be specifically yours and for your reasons. But our can'ts become cans when we start getting diagnoses, and when they start adding on all of the things that we once thought we couldn't do or achieve, become our cans. I'm currently doing. And I just wish we lived more in the moment before diagnosis than waiting until after diagnosis for us to go, but I could still do these things, or no, I'm going to do it now. But I am glad that you show up for you, Amy. I'm glad that you're like, you know what? It's a hot hell no. You're not about to tell me I can't do this. Give me one logical reason why I really actually can't do this and why you want me to sit sad and isolated. I think they remove the people. They want to protect us so much that they remove the compassion component of our care. And that is people interaction. To isolate us is not to heal us, because it only breaks down a different part of our body, which would be our minds.
Absolutely.
Yep.
Amy, what advice would you give to someone struggling to advocate for themselves within the medical system?
To stop and look at your appointment as your doctor is not your friend. I think a lot of people look at their medical industry and the people in the healthcare system as like authoritative figures.
Mm-hmm.
That's kind of the mentality that I had growing up. Like, my doctor knows a lot more than I do. They're an authoritative figure, and that's their job, is to tell me what's wrong and how to treat it, whatever the case, whether it's a common cold or a chronic illness. But people need to stop thinking that way. And the best way to go into an appointment is like you're interviewing a doctor. Make sure that you ask questions. Don't be afraid to ask questions. Don't be afraid to ask for tests. Don't be afraid to tell the doctor, like, hey, I Googled my symptoms and I think that it could possibly be this because of XYZ. Don't be afraid to speak up. And if you get a lot of backlash from your doctors about like a test, like, oh, I don't want to test for whatever their reason being, the best advice that I've heard is to turn to your doctor and say, okay, can you please note that in my chart, like why you don't want to give the test? Because 98% of the time they'll stop and end up ordering the test because they don't want that to go in their chart. Because if something comes down the line, like, that's a cause for them to be sued. So most of the time they'll end up ordering the test, unless it's some extremely invasive test. They'll try and order a less invasive, which I'm all for, but then not questioning blood work. The most common thing that people hear from their medical professionals is, oh, your blood work looks fine. And they just want to stop there. They don't want to further investigate. And that's when you have to say, okay, but my symptoms are still here. We need to further investigate this, because obviously not every disease, not every chronic illness can be found in blood work. And pulmonary arterial hypertension is one of those. So for years of hearing, your blood work looks fine, your chest x-ray looks fine, your CT looks fine, there's more. We could be doing more, especially with the fact that it took them almost 2 years to finally order an echocardiogram, which is one of the least invasive tests out there. It's literally an ultrasound of your heart. And so that, and then the last one is, if you're not getting what you need from that doctor, look for another one, because you will find a doctor who's going to listen to you. It just may take some time. Those are the advices that I give to people.
Can you tell me a little bit more, or tell us about Lemonista?
I was on top of my pulmonary arterial hypertension diagnosis and sharing my story. I was diagnosed with breast cancer on September 13th of 2024. So this was 6 months ago. I found Know Your Lemons is a nonprofit organization. And their main mission is to spread awareness about women's breast health. I had come across them from another, what they call their advocates are Lemonistas. I met another Lemonista at the Healthy Voices conference last year. She's the one that introduced me to Know Your Lemons and the 12 signs of breast cancer, because I didn't know them. I had actually made a video about the 12 signs of breast cancer that caught Know Your Lemons' attention. And so they reached out to me and was like, hey, we loved your video. We would love if you became a Lemonista for us. I was like, sure, all about it. So Know Your Lemons is a nonprofit organization. Their main goal is all about women's health. They have a free app that can check your risk factors for breast cancer. They will show you how to do a proper self-breast exam. They can set reminders for you to do the self-check, because you're supposed to be doing it every month. One of the great things about the app is it's available in over 34 languages. So it's completely accessible to everybody. I didn't feel the lump until August. And I had that mentality of like, oh, I'm going through so much. I couldn't possibly have cancer on top of it. That was like first thought that went through my mind.
That's real.
Living with a rare disease or chronic illness can feel isolating, but you are not alone. Find Your Rare is more than just a brand. It's a movement. From empowering apparel to real, raw conversations, they're here to remind you that your story matters. Because being rare, it's your superpower. Explore, join, and wear your rare with pride at findyourrare.com.
So I waited. I had an OBGYN appointment scheduled for like a week and a half out. So I was like, I'll just wait. I'll bring it up to my OBGYN. And that's what I did. I had my appointment on a Wednesday and I brought it up to her and she was, yeah, this is kind of concerning. I'm going to put in the referral for the breast cancer center and set you up with they'll either do a mammogram or an ultrasound, depending on what their thoughts are. I said, okay, great. I got the phone call on the Thursday from the breast cancer center. They were like, okay, we'd like to get them in on Monday. And that way you don't have to wait too long. I said, okay, that's fine. Again, I had no urgent need to get this taken care of. I went in on that Monday for my appointment. They did a mammogram followed by an ultrasound, and the doctor came into the room and said to me, I'm not going to lie, it's very concerning, but we are not going to know anything unless we do a biopsy. It could still be nothing. I want to schedule the biopsy. I would ideally do the biopsy today. However, you're allergic to lidocaine. I need to order an alternative numbing agent to do your biopsy. So I want you to come back tomorrow. I said, okay. I went in that Tuesday for the biopsy. I got the phone call that Friday that I had breast cancer. And it's very surreal. I've heard it since it happened to me. A lot of people refer to that moment of you're never going to forget it. But at the same time, you're going to forget it. I can tell you where I was when I got the phone call. I can tell you I cried as soon as she said the words, all that stuff. But I can't exactly tell you what she said to me. I got maybe bits and pieces of what she was telling me in that moment, but it was very surreal and very life-changing. I was diagnosed with invasive ductal carcinoma, which also called IDC, which is the most common type of breast cancer. Basically, it just means that my breast cancer started in my milk duct and it had spread outside of the origin. I was triple positive. I was positive for the estrogen and the progesterone receptors, as well as the HER2 protein, which I had to look it up because I had never heard of it. But the HER2 protein, it's found in the surface of the cells, and that's what contributes to cell growth and division of your cells. So everybody's body produces this HER2 protein. And when somebody with breast cancer is diagnosed as positive, whether it's for the hormone or this HER2 protein, it basically means that the cancer was feeding off of the estrogen that my body was producing, off of the progesterone that my body was producing, as well as the progesterone pill that I was taking as a birth control supplement, and the HER2 protein. So when that all comes into play when being diagnosed and figuring out treatment for breast cancer.
I had a hysterectomy when I was 26. I only had one ovary because I lost the first one at 8 months old. Long story there. They only did the hysterectomy at 26. It was when I was 34 years old that they finally took my ovary. And I had to start estrogen afterwards. Since then, they constantly are talking about when they should take my estrogen away. I can't help but wonder if part of that is because they are worried about things like that with people. But they don't tell you that. So then you have to figure it out on your own, or you have to figure it out by talking to people and going, they're worried about that.
Oh, so my thought was my ears perked up because you were at Healthy Voices and I want to talk about that. Can you tell me about your Healthy Voices experience? What was that like?
It was amazing. It was my first year going. And it was life altering, I guess is the best way. I met so many other passionate health advocates out there from all kinds of chronic illnesses. I met people that were legally blind. I met other cancer survivors, whether it was colon cancer or prostate cancer or breast cancer. There was even some people there who had gone through leukemia and lymphoma. And to hear the work that they do within their advocacy journeys, it's amazing. I felt extremely out of place, imposter syndrome, because here I am thinking, I'm sharing my story, I'm doing great things. And then there's people who've started nonprofit organizations or who have submitted bills to their local representatives to get change in the White House. Do you know what I mean? Like, it's crazy how much more you can do in the advocacy realm that I did not know until I went to Healthy Voices. But it is so much fun. And the whole thing is sponsored by Johnson & Johnson. I met a lot of employees from Johnson & Johnson and heard so many other people's stories. When I applied, it was prior to my breast cancer diagnosis. When I was accepted, it was prior to my breast cancer diagnosis. So when I got that diagnosis, knowing that in a couple of weeks I was going to be going to this Healthy Voices conference and I was going to be able to talk to other women who have already gone through this, it was definitely what I needed in that time in my life. And a lot of the women that I got to talk to, I don't think they'll ever realize how much that they helped me because, like I said, it was everything was fresh at that moment. It was right after my diagnosis. It was before all my tests, all my scans, all my treatment. I definitely needed it. And I reapplied. So I'm hoping I can go back again this year.
That's a great segue into my next question.
Yes.
Looking ahead, what are some of your biggest advocacy goals for 2025?
Yep. So one of my big ones is I want to become an actual educator through Know Your Lemons, where it's a program that they pretty much set you all up so that way you can really teach other women about self-breast exams, the 12 signs that they need to look out for. And my goal is to get into the local colleges around here, share my story, and teach women about breast health because they don't do that. Early detection saves lives. That is one of the things that you will hear all over. Know Your Lemons is a huge advocate for because the earlier you can diagnose breast cancer, the likelihood of the outcome. So if you're diagnosed between stage 0 and stage 1, you have a 98% survival rate of breast cancer. So that's what I want to go out there and teach these young women because women younger and younger are being diagnosed with breast cancer. I'm only 35. And it's something crazy like 16% of women are being diagnosed under the age of 50. I guess I feel like it's one of those things that they should be teaching in high school. They go over, the body changes in middle school. I think
Not anymore.
Well, I have my son's kind of going through it. My son's in 6th grade and they kind of brushed up on it.
So what they tell boys and what they tell girls is way different. So the boys get a little bit about how their body works, but when I tell you that for the little girls, they have removed it. They talk about having a period and that's just about it. And they don't talk about how the body works. They don't really talk about how the body is developing. They don't talk about cancers or all of those things. They talk about you could get pregnant right now. And what they're telling the boys is how to put on condoms. The health aspect of the health component doesn't exist. And even more so now because it's super taboo and God forbid you tell my kid something that I didn't tell my kid in my house, but we need to actually have the conversation, right? And so because we've lost so much control over what is, so many people have an opinion over what is deemed educational and what is deemed extreme. The educational components of health and wellness have been removed out of a lot of the education spaces because how dare you want to know how your body works? Wait till you get to college or Google it at home is literally what they're met with now. I can't tell you, I can't answer any follow-up questions. And so I've subbed some health classes at high schools and middle schools. And the thing is, we can't answer the question. Ooh, well, I know you have the question. Go home and ask mom and dad.
Wow.
Yeah.
That's crazy. Wow. I can say my son hasn't come home and asked me any questions yet, but like I said, he's still at the beginning of it. But there is a huge opportunity that's being missed out where these young women can be taught properly how to check themselves and learn the early signs of breast cancer. And it's, like I said, early detection saves lives. And
yeah,
So that's one of the big goals that I have of this year in my advocacy work, is doing that. Another one is I'd like to look in, and again, why I want to go to Healthy Voices again, is look into how I can get a bill written up to get the mammogram age lowered. Because right now it's 40. So a lot of the women that I met at the Healthy Voices conference who are breast cancer advocates are under the age of 40.
I got my diagnosis at 24.
Yeah.
So
see, and I thought I was young at 35. So we need to lower it. And so that's another one that I'm definitely going to be looking into.
Big things. I'm excited. I'm excited to follow your journey. I know you're going to do some amazing things.
Thank you.
And hopefully we can see you there at Healthy Voices. That would be amazing.
Yes.
It's going to be a Spoonie meetup.
Yeah. Where can people connect with you and follow your advocacy work?
They can find me on both Instagram and TikTok. And my handle is Amy's Fight, and it's spelt PH for pulmonary hypertension.
It's punny and I like it. It's
Thank you.
punny and I like it a lot.
Thank you.
Exactly. I love a good pun. They make me be so happy.
Yes.
If you could leave our listeners with one message about resilience, self-advocacy, what would it be?
Listen to yourself. I know it's probably the most cliche one out there, but like I said, nobody knows your body better than you. So follow your instincts, follow your gut, and don't give up.
I could not agree more.
I could also not agree more. So I guess on that note, that was a mic drop, Amy. On that note, don't forget your spoon.
All guests featured or mentioned in this podcast will be listed for your convenience. Don't forget to rate and subscribe to My Spoonie Sisters and follow My Spoonie Sisters on Instagram for updates on new episodes and more. We eagerly look forward to speaking and hearing from all our Spoonies. Disclaimer: while we are not doctors or healthcare practitioners, we want to assure you that this podcast is a credible source of information. It's based on our guests' personal experiences and the strategies we've found effective for ourselves. However, everyone's body is unique, and what works for one person may not work for another. If you have any health-related questions, it's always best to consult your primary doctor or rheumatologist. Remember, our goal at My Spoonie Sisters is to connect people and provide them with the support and tools they need to live better lives.